you only get rid of 12 milligrams at a time, no matter what, it's like the tortoise, it just goes, slow, it's going to take a big dose that's going to take that much longer to get rid of, okay? Regardless of the dose, the rate is constant over time. So high doses take a long time to leave the body, and high doses hanging around cause the therapeutic effect as well as the adverse effect. So if you have a drug with a long half-life that makes you drowsy, you're going to be drowsy for a long time, okay, in addition to its having effect. And another way that it describes it is that the enzymes, remember we talked a little bit about enzymes breaking down drugs, they're kind of like, if you think of them like a sponge, okay, they're saturated with the drug, okay, at the usual therapeutic doses. So you've taken 250 milligrams of something, and you've saturated your enzymes, and they're getting rid of it, they're getting squeezed out, and they're filling up, and they're getting rid of it, and they're squeezed out, and it's getting filled up again. It can only do it at that rate, okay? So dose size does matter. So if you give a large dose, after 5 half-lives, you still got a whole lot of the drug left. If you give a small dose, after 4 half-lives, it's gone, okay? So zero order kinetics, it can only get rid of it, and we know certain drugs do that, okay? Aspirin is actually one of them. Aspirin is one of those kinds of drugs. So it exerts its effect for a long period of time, even though we think of it as a very innocuous drug. What do we know about aspirin? What does it do to the blood? Yeah, it does, okay? So aspirin is not innocuous. Okay, there are other factors that affect, because you're all saying, but what about, okay? That affect how drugs work, okay, and alters their effect. And there are a whole bunch of them, which we'll go through. Patient compliance, okay? Is anybody a house fan in here? Okay. Very non-compliant patient there, would you say? Look at the look on his face, okay? Either the patient isn't motivated, doesn't feel affected by what's happening to them, doesn't understand what's going on, okay? They don't take their medication as prescribed, okay? Often this results from poor communication between the healthcare provider and the patient. Sometimes people are just stubborn. Or maybe they don't like the effects that it has on them, so they fail to take it. If you make the point that I know this is going to make you drowsy, or this is going to make you feel very cold, or this is going to affect your sex life, or whatever it's going to be to the patient, but if you don't take it, or if you don't take it in its entirety, this is what can happen. So it's very important that you take this medication the way that we showed you, okay? And then when you're done, you're done. So you really have to plug into somebody's belief system. We know that motivating a patient is a very individual factor, okay? So after you finish with taking this, this medication for this infection, we can get your cleaning done, and then we can do your tooth whitening system, okay? That might motivate someone, all right? So you have to plug into their belief system. Okay? Patient compliance is huge, huge. What about psychological factors, okay? What about your attitude? Yeah, you can take this and it's probably going to make it better. No, okay? You need to really be informative with the patient, be very positive about the effects that it's going to have, okay? And we know that there's this placebo effect. People have taken sugar pills and had an effect, but there's a placebo effect in that your motivation of the patient, and your education of the patient, and your patient's willingness to get better definitely has an effect. And we know that that motivation drives people to feel better. Even if you have 2 people taking the same medication for the same period of time, the one that has a positive attitude might actually get rid of the problem faster than the other. That's a placebo effect, all right? So the magnitude of that effect depends on the patient's perception, their individual, beliefs and that sort of thing, okay? And telling a patient that we care about them and that we care about what happens to them and taking the time to do it is very important from our end. We can't control what the patient does in response, but we can do that. What about drug tolerance? We hear about this, and we hear about this a lot when we talked a little bit about the opioid epidemic, okay? There's a huge tolerance to opioids. So people that are taking an opioid for a short period of time because of surgery that they just have and is willing to give it up, okay, great.